The Gates Foundation makes global health a core priority, tackling infectious diseases and maternal and child health. For the first time, the foundation has put up a pop-up here at the World Economic Forum called The Future of Health. So let's go see what there is in here. Hi,
hello.
Ambika.
Nice to meet you. I'm Patrick.
Patrick McMahon, right?
Yes.
Pleasure meeting you. Tell us, Patrick, what this pop-up is really cool in the middle of the promenade here at Davos at the World Economic Forum 2026. Tell us what exactly is here, what all do you have when it comes to innovation in healthcare?
Yeah, my pleasure. So we are here highlighting and telling stories that collectively we call the future of health, highlighting about 20 or so different innovations that can help improve lives, reduce and prevent maternal and childhood mortality, and help continue the trend that the world has been on for the last 30 years of reducing mortality, especially focusing in low-income countries. So we have a wide range of innovations. Some are high-tech, some are low-tech, some are in development, some are already starting to show up in the market.
And a lot of AI and technology as
Several
well?
of them utilize AI.
Why don't you take us through some of your favorite ones, and how many technologies and innovations do you have here in this pop-up here?
Yeah, officially there's, I think, 22 different innovations if we added them all up.
So the ones you would want to take us through.
So one that's particularly exciting for me, I think, is the idea of the mobile, portable, but AI-assisted ultrasound.
Okay.
So this is just one example here. But the idea is an ultrasound probe that could be connected to a phone or a tablet is the entirety of what a health worker might need.
So ensuring that it reaches each and every one, last mile connectivity as well,
a little,
right?
Yeah, a little bit along those lines. But then the other challenge is, there can be challenges with equipment access, having access to the technology. But then there can also be barriers for access to specialists who might be able to assess and officially use different technology. And that's part of the role that AI is being explored, to think about what's the role that AI could play in creating better access, not just to the hardware, but also to assist with diagnosis or recommendations. And so a health worker might be able to use the AI ultrasound. It can coach them on making sure they're holding it correctly, but then also flagging if it might be a high-risk pregnancy and refer them to an actual specialist.
Okay, great. What about...
This is an eye exam test. This is by a company called Remedio.
Okay.
And so while you're visiting a health clinic or a health worker, the patient might look through the scope, the health worker on the other end, and it assesses their, I think their retina, but essentially it's an eye exam.
And this is for to cast gestational diabetes.
And it can diagnose gestational diabetes. Yep. And it uses AI to help.
So again, the preventive approach.
The
Again, looking at the prevention. Next, Patrick, I see a lot of vaccines here, of course, and of course, we know the importance of vaccine when it comes to healthcare, when it comes to prevention. Anything specific for India, if you would like to share?
Sure. And this is an example that was actually this specific vial was manufactured by the Serum Institute, based in India. But this is hexavalent vaccine, and so the idea is, I don't particularly like getting jabbed with a needle, and I haven't met anyone that does.
I'm also, I think nobody would like getting the needle.
And so there's an aspect of, through one single vaccination, this protects against 6 different diseases.
Okay, so it's diphtheria, it's hepatitis B, polio,
flu,
whooping cough, tetanus, and of course the influenza type B. So there's one vaccine which covers the 6 preventive diseases. Okay, so that's another great innovation. So that's one. Okay, also I also see the single dose protection against cervical cancer, and then you have the needle-free vaccine delivery. This is what you were telling us about, right?
Yes, and so the idea of, HPV is a vaccine that's been around for several years now, but one of the most recent developments is research has been being done, and more countries are switching to what research is showing, a 1-dose vaccine versus a 2 or 3 dose vaccine can have essentially the same amount of protection. Okay. And that means fewer visits, fewer trips, lower cost.
And the protection is still there.
And the same protection. And so that research has been getting done in more countries. I think even since we printed this, it's now up to 89 countries instead of 84 countries. So more and more are changing by the moment.
Yeah, so ensuring that, one is protected, because cervical cancer is the only cancer which is preventable, right? Yes.
Absolutely.
Yeah. So need of the hour. And this, I guess, is the cooler, right? Which I've seen a lot in India as well. In India we have the ASHA workers, the healthcare workers, which ensure. So I see that this is so that the vaccines stay intact.
Yeah, and this is sort of an,
so can you see that? Because it's a lovely bright...
This is actually sort of an icon in the health delivery world. This is called the freeze-free vaccine cooler. Okay. So a health worker might put the vaccines in here that they need for a day's visits to different communities. Ice packs, of course. But then there's, technology in here that creates a divider between the ice and the vaccine so that it helps regulate the temperature. So that, we know vaccines, we can't warm them up or they run the risk of not being effective, but at the same time they can't freeze either. And so this helps regulate that in a very...
So ensuring that the vaccines stay intact.
Exactly.
Keeping the temperature and also I think easy portable, right? Because ensuring, again, going back to the same thing, last mile connectivity as well, that the vaccines reach each and every one. Again, something being used widely in India as well. Great. Do you want to take us to the next, anything else which you would
so this is a device that's starting to be rolled out more. It's a diagnostic test for tuberculosis. I think many of us are familiar with the idea of doing a swab and...
A sputum test, right?
And then putting the swab in a little vial, and then that would go into the cartridge here, gets dripped into this, and then that cartridge gets inserted into the machine, and in about 30 minutes it gives you a PCR level reading and diagnosis confirming or not.
So Patrick, I mean, correct me if I'm wrong, but this is basically you get the result in 30 minutes, whereas a typical traditional test could take longer?
Yes.
Because tuberculosis is again something which we see numbers, unfortunately, again going up, right? Yeah.
And it's one where some of the most current machines are a little bit larger and a little bit more expensive, and so then sometimes they're harder to reach more rural areas. And so the idea of having something that's smaller, portable, and can offer the same level of diagnosis can be an important tool.
Okay, great. So when, of course, we know the Gates Foundation has been working in the space of health care and, ensuring accessibility to last mile connectivity since over 25 years. Even we've worked as part of our campaign Banega Swasth India very closely with the foundation. Percy, if I can ask you about, what are the things which you think can really work in a country like India? Is there anything specific you would like to share with us?
I think so many of these have the potential to work in many countries, including India. I think really it's thinking about what are the specific local challenges or local needs and who are the right partners to be on board with continuing, whether it's continuing to develop new ideas, continuing to work on approvals and rollout, or continuing to work on scale. But I think everywhere in the world, but including India, it's important to think about how do we prevent maternal deaths, how do we prevent childhood deaths, how do we create more opportunities to improve lives. And so,
so in India, of course that was a challenge, but we have seen that the number of deaths, whether it is maternal or infant mortality, has gone down significantly, right? I mean, and here at the pop-up, which is amazing, great to see the kind of innovations. Well, there are 22 innovations, Patrick. Of course, I can't cover all of them. Lastly, but I want you to tell us, because malaria, again, mosquito-borne diseases is a challenge in India as well. I see something very cool here, the bed nets, of course, which we've seen. But tell us, what is this prevention?
Sure, yeah, and maybe
the 24-hour malaria prevention,
So this is an idea, to complement a suite of malaria interventions, but this is called a spatial repellent. So the idea, one of the common approaches to fending off malaria and malaria-carrying mosquitoes is indoor residual spraying. You would spray your home regularly with an insecticide, and that helps cut down mosquito populations, works well with sleeping under an insecticide-treated bed net. This is an idea that's being explored that essentially you would hang this somewhere in your home.
And this will attract the mosquitoes,
and
right?
it's designed to essentially keep them away, repel them. They don't like what's on it, and so
that's why it's called the 24-hour malaria prevention. And this is the treatment I can see as well. So you have the full thing. Well, you have the nets, but in case net is not possible, you put you put this as a prevention.
Or potentially, see this as a whole collection of how we fight malaria.
Which is again a very, very huge challenge in a lot of countries.
Mosquito nets, and this is what we call a dual insecticide bed net. It's a next-gen bed net that has multiple combinations, sleeping under an insecticide-treated bed net. This is an idea that's being explored that essentially you would hang this somewhere in your home.
And this will attract the mosquitoes,
and
right?
it's designed to essentially keep them away, repel them. They don't like what's on it, and so
that's why it's called the 24-hour malaria prevention. And this is the treatment I can see as well. So you have the full thing. Well, you have the nets, but in case net is not possible, you put you put this as a prevention.
Or potentially, see this as a whole collection of how we fight malaria.
Which is again a very, very huge challenge in a lot of countries.
Mosquito nets, and this is what we call a dual insecticide bed net. It's a next-gen bed net that has multiple combinations of insecticide to fight resistance. But that works when you're sleeping under it.
And this is to make sure the mosquitoes come. attracted there, and this is the treatment.
And this is a new treatment that they're doing final tests on, but so far it's shown that it's been 99% effective in just 3 doses over 3 days, which would be potentially the first new major malaria treatment in 25 years.
Well, I really hope that works, but it's really been a pleasure. Thank you for taking us through all those innovations, and it's a great idea to put this pop-up here, really to ensure that healthcare reaches each and everyone. Thank you so much.
Thank you for exploring the future of health.
Thank you.